Welcome, everybody. It's time again for another episode of Health Talks with Dr. Trinh. The one show that takes all of the complex health questions and craziness facing us these days and tries to put it in simple terms. With the man who simply does it the best, Dr. Trinh. Hey, Dr. Trinh, how are you?
Hey, Paul. Good. I'm good. Welcome.
Let's remind
Is it?
everybody some of your credentials. We'll do this for a while as people are getting used to the show. You speak a lot about topics. You're not just a practicing physician. Yes, you're at Memorial Care. Yes, you have research you do with Irvine Clinical. You're on the board of Alzheimer's and all these other things. But part of what you do, what your passion, and I think what you do best, is taking the complex issues that plague us, that perplex us, and put them in simple terms that even I can understand, and maybe give us a little assurance or a little reality along the way here, because there's so much confusion. Wouldn't you agree?
There's a lot of information out there, especially when you do an internet search. You can find anything you want to find to
Yeah.
support any position you want to support.
Are eggs good? Are eggs bad? Is it better to take a little glass of red wine? Is it not good? All those may be silly examples given the state of confusion these days around this COVID crisis. But I thought we'd talk a little bit about this because it looks like we're getting ready to try opening up again. We've stuck our finger into the air.
Yes.
We've looked around. We're sticking our heads out of the rabbit holes here, our bunkers, and we're starting to feel somehow confident. I don't know if that confidence is warranted or not. Do you think we're ready to open? And if so, let's talk about how should we open? Do we just throw everything caution to the wind, or do we slowly stick our head out and peer around? So let's start with the first question. Everybody's debate of the day. What do you feel comfortable opening in some sort of early rollout, reopening?
So what's interesting is whether we're comfortable or not, there are a number of states that are opening now.
Right.
I think last time I read, there's about 8 states or so that are opening this week. It is so there's 2 sides of the debate. There are those who are ready to go back to work. There are those who are ready to go to the movies, to go out, to go to a restaurant.
They got cabin fever. They can't stay in the house anymore, or they can't,
fever.
or their business is suffering and they need the money. Yeah, right.
Yes, and then there are those who definitely want to stay closed for a much longer amount of time due to the fear of this second wave of
yes, we're going to talk about
infections.
That today.
Right, in the second wave. So I'm not sure if I know the perfect answer. I do know that if we do open, it would be really good to know who's already had the infection,
right?
Who's already tested positive and now are fine. Although I must say that having the infection tested with an IgG antibody test, we still don't have proof that it is going to protect you 100%.
Right. Or for how long?
For how long from getting it again. We don't have data on that. But it'd be good to know, because the chances are probably better that if you've had the infection and that if you've recovered from it, you're probably less likely to have it again than somebody who's never had the infection.
So let's unpack some of those things along the way here before you rattle off some more here. So the number one thing is, and I ask this because we're a radio station, we get invited to the weekly press calls that the County of Orange does. They do them on the phone. We get to all ask questions. I'm there with Channel 7 and the Orange County Register and everybody else. So my question last week was, what criteria are we going to use? And is the criteria going to be set by the federal government, by the state, or by the county? Their answer was, we'll get back to you. We don't really know. That concerned me. So I was looking at some of the states that are talking about it, and one of the guys I seem to like, I'm not alone in this, is Mario Cuomo's son, Andrew Cuomo, the governor of New York, who does a daily briefing on this. And I'm not saying he's any better, but he does it in a way that I can kind of clearly understand. And his theory was, and everybody's going to have a different one, is that it's like 3 dials. And I think of it as steam valves, and we're going to let a little pressure out. We're going to open it up a little bit, let some of the people flow through the pipes here, And if it gets too out of
Right.
control, we'll shut the valves back down again here. And the first valve was how many people are coming to the hospital. Let's start with that one. That seems to be kind of on a slow decline. Not everywhere, not in Georgia and some of the other places that are opening. They're going ahead without that. But that was one of the federal
Right.
guidelines too. That for 14 days, you got to see some decline
Right.
in hospitalization rate. Talk about that for a little second. Where are we at today with that?
That's really important that we do see a decline in the rate of hospitalizations because we need to know that we have the beds
Right,
available in case of that second spike, just
right,
in case,
right.
right? Because if all your hospital beds are full because of COVID, and now you're opening up again, and you have no available beds, that doesn't quite make sense, does it?
No, it means like we're going to go. We've done all this for nothing. Then, if because it seems like
Right.
it seems like there were maybe I'm overstating this, but you can correct me if I am. It seems like the only reason we had to shut everything down was two things. One, we were afraid of the models that showed the hospitals were going to get overwhelmed, so we needed to cut back and dramatically lower the curve, slow the infection rate, slow it down, because there were projections that, oh my God, we're going to need millions of beds, way too many than ventilators and everything, and we just don't have that capacity. So that was the first. And the other one is even more basic, and nobody really ever talks about this. It seems like we didn't know how many people had it and who they were, where they were. So in the absence of
Right.
knowing who's got it, let's just shut the whole thing down and try and get some handle on this thing here. And that was a heavy-handed way. Somebody described it once. It's sort of like taking a hammer to get out a sliver. There's some small part of the population that's at risk. It's a significant population, and they're significantly at risk. But it's not 90% of the population or 95% of the population that's going to die. They might get it. So, but to protect that other percentage and to prevent hundreds of thousands or more people dying, we needed to shut everything down. And that really took a hammer to our economy and to our psyche, I think, here.
It did. I think that's what 26 million Americans out of work or somewhere around
Yeah,
that
right,
ballpark.
right. I mean, this is like,
Very, very scary, and our economy has definitely suffered from that. I've known so many people who are no longer working,
yeah,
who got laid off, and even physicians' offices are laying off and furloughing,
yes. Which
and
surprises me, but
hospitals as well.
because they don't have people
Yeah,
coming in anymore for the regular procedures that they were counting on.
that's that's correct. So they've lost a lot of revenue from that, including the medical industry.
So because
So
so if that's true, that the reason we shut it down is we just didn't have, because we didn't do rapid testing, we didn't do massive testing. Maybe we couldn't have, maybe we should have, maybe we'll all debate about that over the next year. But because we didn't have that data, we don't know who's got it or how many have got it, we shut the whole thing down. If that's true, and I said to the county, we still don't know how many have it
we,
and who's
we still
got it.
don't know. We're
Yeah,
still not doing rapid enough compared like Korea, right?
right.
We do have some rapid testing now. I know at Memorial Care there's rapid testing,
Is there? Okay.
uh,
So
but there's limited.
Governor Cuomo's
That's,
second valve. First one is hospitalization rates, like the federal government
mhm.
has said. We want to see a decline for 14 days. That tells us we're on a downward trajectory. But his second one is we need to do rapid testing of people who might have it, not just people who show symptoms, but who don't show any symptoms. We really do need to test a large percentage, a significant percent of the population. How big of a, if there are 3 million people in Orange County in a perfect world, how many would we test? 3 million? Half of that? A third of that? A
Right.
tenth of that?
Yeah. Well, definitely not 3 million, but a significant number of folks, so that we know how far and how deep this virus has penetrated into our population.
Right.
We need that number to learn about herd immunity,
Right. Exactly.
right? Because if you're gonna have herd immunity, where maybe 8 out of 10 have already got this infection, and you
Hmm.
know that by having herd immunity, the virus will have a difficult time jumping from patient to patient.
Right.
We don't get that number about herd immunity unless we test,
Right. And
unless we test the herd.
and I don't feel confident, just me personally. I don't care when they say it goes out. I'm not sure I'm rushing to a baseball game or a restaurant or a crowded place right away. I'm not sure I do trust that it's safe. But if you told me that half the population had been tested and half of them already had it or whatever, if I knew how, if I thought we had a better handle on how many have it and who's got it or who had it, I think that would help ease my concern. And so I wonder, we're all rushing to open businesses. I'm not sure everybody's going to come back.
Yeah, and if they come back, they'll probably come back with a mask on.
Yeah, and keep the distance, and they're going to they're going to limit the amount of time they go to the retail store. I'm not going to go shopping for furniture tomorrow in a retail store. I'm not going to a movie theater. I'm not going to a baseball game, even if they are open. I'm just not going.
Yeah, and I think that if, let's say, if restaurants open, it wouldn't be a bad idea initially that restaurants that do open seat people a little bit farther apart. Right. Just as a initial phase in that's slow, but is safe at the same time.
But are they ready to do that? So Governor Cuomo was saying this. He said, as we do allow businesses to reopen in New York, and maybe this is a model for other places, or maybe this is too severe, he's saying we're going to have to work with them business by business to get them to space people out in that office where they tried to pack them all in because rents are expensive, in that restaurant where they tried to pack them all in because rents are expensive. They're going to have to spread them out more. That means changing maybe not using every desk right away, not bringing every person back, not trying to fill every table right away here. So you think that makes sense? We should sort of continue to space?
It makes sense. It makes sense to do a phase in. Rather than black or white, 0 or 100%, you go in slowly, and then you test the waters to make sure it's safe. And as things roll on, and you realize, the infection rate has dropped a lot, despite the slow opening. Based on your data, you can continue to open it up wider, but as long as you keep the infection rate down as you're opening up.
So again, we were only at 2 of his valves. The first valve was the one the federal government talked about, a decline in people showing up at the hospital, sick, needing beds, needing ventilators, needing care, urgent care. The second was ramping up. Don't stop testing people. Test more people, even people that aren't showing symptoms, so we can get some idea how many still have it out there. And then the third is the one that we're still a ways off. Even Dr. Birx talked about this. She's hopeful we're closer than, we may be in a month or 2 away, but they're rapidly trying to come up with this antibody test to show how many had it. Maybe they didn't even know they had it. They just thought it was the flu or a cold or something a month or 2 ago before it was on everybody's radar. And how many people might have antibodies built up, even though, as you said, we're not really sure the antibodies work at all or how long they last.
Right. The other thing that the CDC has updated us with is that they added on a number of other symptoms that are correlated with COVID-19.
I saw that. Let's talk about that. Well, give us a couple of those that they're now associating.
So,
it's not just
we know
fever.
The obvious.
Yeah.
Right. We know the obvious: fever, shortness of breath,
coughing.
Cough. Those are the obvious ones.
Right.
They've added like the shakes,
chills,
the chills.
Right.
And then they also added the loss of taste and smell.
Yeah, that was a weird one. Nobody's been reporting that one. At least nowhere that I've seen that suddenly I can't taste anything.
Yes, I've had a few cases actually that I've heard of and was brought to my attention on the loss of taste and smell as one of the initial symptoms of COVID-19.
Mm-hmm. So for example, I'll use myself as an example. Back in December, when it was flu season, I had a doozy of a flu. I mean, it went on for weeks. And I did have some chest pain, so I went to the doctor, and he just said, well, it's probably just, and I felt like it had gone into my lungs, and I was coughing very hard. I didn't have a fever, but it hurt. I coughed so much it hurt, and it took weeks to go away, much stronger than I've ever had before. Now, this was late December, January. This is way before anybody's talking about COVID or anything here. And I read that some people are theorizing maybe this came over much sooner. Maybe I had it. Maybe there were others like me that had it. Maybe I didn't, but maybe there were people in December and January that had this but weren't diagnosed because
Yes.
they didn't think of it as anything severe or different.
Right, right. We are starting to learn that this virus may have been here in the fall
Hmm.
of last year, based on symptoms of folks who were diagnosed, and so that suspicion is there now. The question is, how do you prove it?
The antibody
Uh,
test, right? So you got to go to that third one. So his theory
that's right.
again, Governor Cuomo is, he said, I'm going to be like the man on the, so we're going to open up. We see hospitalizations decline, open it up a little bit. We start getting more tests out there, the rapid tests, quick tests,
Right,
do-it-yourself tests, home tests, faster tests. That'll give us
right.
a few more out. And if we start seeing a bunch of people have antibodies, we'll start doing it. But if any of those come back bad, let's talk about this for a second. Do they shut it down again?
Good question. That's why it's got to be a really slow start. Um, because if it starts to look really bad as far as more hospitalizations, more patients going to the ER, then we know that we've started too soon
Right. Or did it too fast? We went too far. For
or
example,
too
Orange
fast.
County opened up their beaches. It was hot first
Right.
weekend, and everybody said it was packed.
It
Did
was.
people just run right back out to the beach and forget about all the thing they've lost? Let's talk about that for a second. What do you, now I'm older, so I'm going to be more cautious, but I look at my daughter and son-in-law, they're in their, late 20s, and they're immune, they're Superman. I think they can't
Right.
wait to throw their masks away, and I think they'll
Yep.
go right back to the way things were and just assume. But one of the things I've heard, and comment on this, is it just an old folks disease? Or because I'm seeing people, I heard a weird report the other day, and again, who knows if it's true or not, but it was one of these things you read, that they were seeing a spike in 30-year-olds having strokes. And they thought might be,
Yes, yes, I've read that as
it's
well.
like,
It's
what is
certainly
that?
not just an old folks disease. Although, if your immune system was lower, um, it has a higher chance of landing you in the hospital.
Right.
But there is we've seen a spike in strokes in young folks,
Strokes and yuck.
with
So
this
that was one
condition.
nobody saw coming. So my 30-year-old son-in-law, he thinks he's impregnable, and yet
Right,
not only are they getting it, but they're getting some. Again, I don't know what statistical number. All of these. What do you think? When you first came on and talked about this, you said that some numbers I've been sharing with everybody, because in the beginning there was a lot of talk on the national level and a lot of different levels. This is just a bad flu. The flu killed 10
right,
less than 1/10 of 1%. We still don't
right.
know. This might kill 1%, 2%, 3% of the people that get it. That's at least 10 times, maybe 30 times stronger than the flu.
Well, that was the data we had back then. That number may change as we are able to test more people.
Right.
Right. So if we tested the entire population and found out that a whole bunch of people have already been exposed and infected with this, then that changes your denominator
Right.
in your death formula. So it may bring that
In
death
your death
rate
formula.
all
I
the way
love it.
down.
You just said that so
Yeah.
quickly. In your there's a death formula now we have to take
Yeah.
in.
That was bad.
What's the death
That's right.
formula? Right.
But that number may go down if we found out that more people were infected than we thought.
So here's
Right.
another
So
question for you, and this is a more
yeah.
philosophical question that maybe you can help us answer. I don't know who else to ask these days. Because business is suffering, massive. Could be temporary blip, could be depression era blip. I see numbers all over the place from one extreme to the other. Like it's going to be bad, but we're going to get back quickly, or no, this is going to knock us on our heels for some time here and deeply. Whatever
Right.
that, I get it. The one thing I've not been a fan of the president, but the one thing I will agree with him: we can't keep the businesses closed forever because we'll all be
Right.
alive and our businesses will be dead. So there is some
Right.
truth to that. Now, but if we rush back too quick, then all we've done has been wasted, and we'll have to shut it all down again here if it starts getting out of control and the hospitals can't handle it and everything. And so the question I come to is a question I don't think we as a society, we as a people, have ever asked of ourselves, not since my grandparents' era, and that is, what is the acceptable death rate? What am I willing to live with? 1%? Okay, roll the dice, I'm going back out there. 2%, 3%. And I'll preface it by saying the last time we saw this kind of massive flu pandemic, people keep talking about a big history buff, 1918, 650,000 Americans died over
Wow.
three
Yeah.
waves. It didn't hit once, hit twice, 3 times, till it finally burned itself out over a year period of time. But why is that not front page in your American history class? Why is that a forgotten footnote in history here? One, because it was right at the end of World War One, and 11 million people, 20 million people got killed.
Right.
And two, because people didn't expect everybody to live back then. If you had 6 children, my grandparents, when they,
Yes.
when they had children, they looked around and it's like Tiny Tim. One of them, they didn't expect all of them to live.
Right.
They accepted that they didn't like it,
Right.
but I guess that's why I had 8 kids, because one of them's going to die along the way here. All sorts of things: typhoid, measles, polio. All it wasn't. This wasn't the only one. Today
Right.
we live in a world
Right.
where that's inconceivable. I have 2 grandchildren now. Am I going to look at one of them and say, well, gee, if one of them makes it, I'm lucky? No, I'd be horrified. I'd be devastated if even
Wow.
one lost at this pace. So I don't think any of us are ready to ask that
Yeah.
question of what is an acceptable death rate. What do you think?
Yeah.
Anybody ask you that? I mean, because
I
that's
don't
what we're
think there
talking about.
is.
We're saying we can't wait any longer, so there's some risk. Some people are going to die, and as long as it's only X number, I guess we'll do it, and we'll accept the risk. We'll roll the dice, we'll open the doors, and we'll all head back to work here.
The only death rate that's acceptable is the one where you're not the one dying or your family member.
Exactly.
If you're the one, if you're the one, or your family or your friend is part of that statistic, it doesn't matter what the death rate is.
Right. Right. So then it's a question of what if it's not an acceptable death, what's an acceptable risk? What do you think people are willing to risk? For example, I didn't know that many people really die from the flu. None of us want to think about how many people die in car crashes. We just block it out. We're going to block that out because we're not going to give up driving. So is it just one of those things we just factor in there's a risk and we try not to think about it?
Right.
Or is it still so frightening?
I think in this discussion, many have compared it to the flu. Is COVID-19 worse than the flu or similar to the flu?
Right.
And because we're so used to the flu, although nobody realizes that in any year up to 60,000 people can die from the flu, which is a lot.
Yeah, I never knew that. I would have never guessed it was that high, because the flu is the flu.
Yes.
You get it, you feel bad, and maybe
Right.
a couple real old people die, but I assumed very few people died from the flu.
Right. So 60,000 is quite a good high number, actually, when you think about it. But so folks have been using the flu numbers as a yardstick
Right.
for how severe coronavirus is. But I go back to the same question. If one of your family member was the one affected by corona and died, it wouldn't matter to you whether it's 1% or 0.1%.
Right.
It's way too much.
Right. So we've got a bunch of people saying, okay, let's just get back to work. And it's like war. There's an acceptable risk. We're going to charge that hill tomorrow. We know that 1,000 people are going to die. All right, that's acceptable losses. Again, as long as they're not your losses, your friends, your family. And I think
Right.
that's part of what's tearing the country apart, because talk to me one last thing here, and then we got about 5 minutes to go here. It doesn't seem like it's spread evenly across the country. It hit big cities and the coasts. It doesn't seem like it's penetrated into the heartland, into the small towns. Is that just because smaller populations, more spread out?
Yeah.
You know,
I think it's high density.
yeah,
If you live in an area that's high density, meaning people are sardined on top of one another, like in New York City,
right.
right? Compared to the Midwest, where you got farmland and you're kind of spread out more. I think that's probably a huge difference with that, which is maybe why Los Angeles is worse than Orange County,
Right,
perhaps.
exactly, right. And that's why a lot of these
or-
rural states are saying, I'm not going to stay closed anymore. We're going to open up. But then you got Georgia, because all these states have some mixture. Georgia's saying the heck with it, and they're opening up. They're the first out. A lot of criticism. but a lot of people applauding at the same time, saying, "Attaboy, let's just go. The heck with it. It's not that bad."
Right.
And yet the infection rate in Atlanta's been bad. So
So
Atlanta,
bad.
they don't want to see it open. But if you're out in the sticks somewhere, it's not so bad.
Right. That's correct. That's correct. They're already social distancing.
Yeah, right. Yeah, right. Now, on the flip side, though, the fear was that if it did infect these small towns, they're even less prepared to handle it. There's no hospitals in these little towns anymore. There's one respirator for every 100 miles or something here. And so if
That's
it did spread, and in a world where truck drivers are crisscrossing the country and bringing groceries into every little town in America here, people are crisscrossing the country and traveling. These little farms aren't as isolated. These small towns aren't as isolated as I think they expect they are.
right. That's right. That's right. So it'll be very interesting. We'll know in the next few weeks
Yeah.
which way we go. I know that New York and California governors are a little bit more strict with opening up than the Midwest or Middle
This,
America,
right.
but they have reasons to be a little bit more strict because of the death rate and the hospitalization rate we've seen up in the Bay Area and in New York City and areas of that sort.
Yep. Well, we did is just touch on the points. I don't know that we came up with any answers here today, but at least we laid it out. We are getting ready to open, whether we like it or not, whether we're ready for it or not. And in our next episode, I want to talk about steps we should be taking as we step out. And it varies, obviously, depending on what your age is and what your risk factors are, but just some common sense. Let's talk about let's take it down from the society level down to the personal level here. What are you
Right.
going to do? What are you telling people to do? So we'll talk about that in part 2 of our discussion on, are we ready to open up again here?
Sounds great.
You've been listening to another episode of Health Talks with Dr. Trinh, right here in Orange County's only community radio station, octalkradio.net. Okay, there we go. That's how we do one here.